Hello, I'm Dr. Rudy Kasha. I have offices in Sacramento and Granite Bay. And if you're watching this video, then you're either considering or you're set up to see me for in this case, a mastopexy or a breast reduction. So that's a breast lift or a breast lift with a reduction. So we're going to talk about that and give you some important information to help you along this journey. Basically, first off, a mastopexy and a breast reduction are very, very similar. A mastopexy or a breast lift is just a breast lift with minimal reduction of tissue. It's just taking the skin out to lift everything up and position it appropriately. A breast reduction is lifting everything up just like a breast lift or mastopexy, but also significantly reducing the volume of the breast tissue. So it's basically what a person's presenting with and what their desires are that kind of dictate which road we go with. A little bit bigger of a surgery for the breast reduction just because we're removing more tissue, but for all intents and purposes, fairly similar. A lot of this comes from a couple things. So a breast lift itself would be if someone has some volume, enough volume where they don't need an implant, but the nipple and the breast tissue is in an inappropriately low position, oftentimes after childbirth, pregnancy, breastfeeding, that sort of thing. That usually is the main culprit for that. But they have enough fullness or they're not trying to achieve too much fullness. So we're not talking about an implant in that case. We're just lifting everything up. A breast reduction would be someone that had, sometimes even at a young age or later in life, just developed a lot of breast volume. And that's hurting their back, their neck, or aesthetically just not something that they're pleased with. And so in that case, we're lifting everything up, but taking a considerable amount of breast tissue out so that we shape it better and we position it better and reduce some of that kind of over-haunching feeling on the shoulders and the neck. With both procedures, they involve incisions, unfortunately, so that they're visible and will be visible forever. For the most part, the particular type of incision that I like to use is called a wise pattern breast lift or wise pattern breast reduction. That's an incision around the nipple, straight down, and then underneath. That allows you to shape the breast the best, as well as remove tissue mostly in that under portion of the breast so that it gets more of the upper pole fullness there that we like and is much more aesthetically pleasing. That particular incision, any breast lift type incision, leaves you with those scars around the nipple, straight down, and then underneath. So that's kind of the unfortunate trade-off that goes along with that. It will always be visible, but we do things to try to make those look as good as possible. Obviously, that's our job. But we also have some scar gels and different things that do help. The rest of the scarring portion, unfortunately, is up to you. Everybody scars differently. Some people get wider scars, some darker or lighter. So that's something that's based off of genetics, and your skin complexion does play a role that our hands are a little bit tied on. But we'll do everything we can to make that look awesome, but the shape will really be something that's nice and improved. This is actually not a very painful surgery, surprisingly, because it's basically a skin and a breast tissue type of surgery. So it's something that doesn't involve muscle, which muscle is what hurts. So you still have a recovery period, we'll talk about that, but basically something that you should tolerate quite well afterwards. I think to know with breast reduction or breast lift, oftentimes I do send the breast tissue off for pathology. If it's just a tiny little bit that comes out, a lot of times we'll just discard that. But if it is somewhat of a substantial amount of breast tissue, I will send that off to a pathology department. They'll look through that and they just scan it over, making sure there's no precancer or cancerous lesions. Unfortunately, I have caught a couple of those throughout my career, and that's obviously a very saddening thing to find, but it can be a life-saving thing to find. Something that mammogram or other things didn't even pick up, have found those and then they're able to be dealt with. So that's something to be aware of as well that we do with that. With any type of surgery, there's risks, so typical surgical risks like bleeding, infection, that sort of thing. But with a mastopexy or a breast reduction, there are risk of healing problems because we're making so many incisions and taking out tissue. Sometimes that's just at the little T-point at the bottom or other areas. On rare occasions, it could involve the nipple. There are risks of loss of nipple sensation. That's probably somewhere around 10% or so of a risk there. Sometimes that can come back, but occasionally that can be permanent, so that's one thing to know as well. There's risk of bleeding, where you could get a hematoma and need to go back to the operating room. It's not very common with this type of surgery, but it does happen every now and then. And other typical surgical risks that you should be aware of. There's going to be a lot of information you'll read in your packet that will detail all of that. Should be aware of that. But all in all, fairly straightforward surgery. For the surgery itself, we have our own surgery center at the Sacramento office and the Granite Bay office. Full team, nurses, scrub techs that work with me all the time. You'll typically, for this type of procedure, have general anesthesia with a board-certified anesthesiologist. The surgery itself will take somewhere between 2.5 to 3 hours. Spend some time in the recovery room and then you'll go home. Typically come back to see me 1 to 2 days after surgery. We check on everything. You'll shower at that second day. You'll wear a surgical bra for 6 weeks that we'll give you. And then after 6 weeks, you'll transition to your own bra. And then after 3 months, you could wear an underwire if you'd like to. For most people, they'll take about a week off of work for something like this, and then 6 weeks of restrictions. So no heavy lifting, no rapid arm motions, no cleaning the house, no vacuuming, no pushing yourself up, pulling yourself up, that sort of thing, because we don't want you to develop bleeding or to tear anything that we repaired with that. But overall, this is tolerated very, very well. Definitely helps the back. Even if it's not much coming off, you'll feel a difference in kind of the vector of pull of your breast on your neck and your shoulders, so it can make a nice difference with that. But that's basically what a breast lift or mastopexy and a breast reduction entails. At this point, hopefully that gave you some information to help with that. You'll see me again if you do proceed with a consult, and we'll talk some more. We'll do an exam, give you some information from there, and kind of tailor it to you. So hopefully that helped. Look forward to meeting you.